The health disparity that I'll be discussing is tuberculosis in Hispanic and Latino populations. Among the Hispanic population, there are many disparities that occur due to many factors such as poverty, language barrier, or lack of health care. Hispanics have the highest rate of tuberculosis in the United States. For foreign-born Latinos to know their status on tuberculosis and get treated, they need to be screened. Knowing your status, education, and adequate health care are few of the ways to reduce the incidence and prevalence of tuberculosis. Tuberculosis is an infectious bacterial disease that is caused by Mycobacterium. It is contagious and can be discharged into the atmosphere from coughing, sneezing, talking, or singing. Some signs and symptoms of tuberculosis are lack of appetite, a bad cough that can last up to 3 weeks, and even a fever. Some epidemiological facts about tuberculosis are: it is one of the most common causes of death from an infectious disease. It is second most common right after HIV. In 2007, the country with the highest estimated incidence rate with tuberculosis was Swaziland, with 1,200 cases per 100,000 people. There are 8.6 million new cases as of 2012, and 1.3 million deaths due to tuberculosis. In an article by Bolter et al., they stated that although immigrants consist of a small portion of the population, 65% of all TB cases that were reported were among foreign-born persons. Hispanics represented 30% of the total new TB cases. In this diagram, you can see how U.S.-born Latinos contract tuberculosis. Those who live closer to the Mexican border are at higher risk than those who do not. So once they're exposed to foreign-born Latinos who have latent tuberculosis, they contract the disease. Hispanics have the highest rate of tuberculosis in the United States. This is due to the exposure of those who are foreign-born and already infected with the disease. Socioeconomic status is a disparity that affects Latinos and those who were not born in the U.S. Testing for tuberculosis has its barriers as well. In immigrant populations, when it comes to the outreach of screening Hispanics, there are cultural, linguistic, and financial barriers. The cause of many disparities can vary. According to an article by Zuniga, for tuberculosis medication adherence, one determinant in particular is cultural factors, which are important for latent tuberculosis. A few other factors that have been influenced for the adherence for latent tuberculosis treatment amongst Hispanics is access to a health facility, the length of time to complete treatment, and confusion about the healthcare system in the United States. There are many causes of disparities amongst Latinos when it comes to tuberculosis. I mentioned in the previous slide there are barriers when screening for tuberculosis. According to an article by Lang and other researchers, language discordance and testing for latent tuberculosis infection among recent Asian and Latino immigrants, they stated that language discordance between patients and medical providers is a major factor that impedes on effective provision of health care. For language discordant patients, communication may be suboptimal. In the article, The Effect of a Cultural Intervention on Adherence to Latent Tuberculosis Infection Therapy in Latino Immigrants, Alinger states that a balanced relationship between the patient and healthcare provider could increase adherence. In a study of 286 Latino adolescents who were randomly assigned to the following groups: usual medical care in combination with adherence coaching, or usual medical care in combination with self-esteem coaching, the group who received usual medical care in combination with adherence coaching showed the highest completed treatment rate. This study shows that in the Hispanic population, we can break down barriers and decrease disparities by working with patients and ensuring that they are educated about the diseases they are at risk for, granting them access to healthcare providers and healthcare facilities, and reduce language discordance and increase adherence and decrease the spread of tuberculosis.